Hello there. Welcome to my channel. My name is Bridget Ezobiako, and this is Bridging Healthcare. It's such an honor to be back again. How are you, healthcare professionals, and how is work? And I hope the weather is treating you well in your area. Whatever part of the world you are watching this class from, please put in the comment section. Let me know where we're reaching. I have introduced myself before, and in this channel, my major mantra is to help you hold your hands to become a proper, effective, efficient healthcare professional. I am Bridget Ezobiako, and I am a healthcare professional, and I love what I do, and I do what I love. If you are new to this channel, please subscribe to the channel, click the bell so that every time I come online, you will be the first to know. What do? I hold the hands of any healthcare professional or would-be healthcare professional. I show you a few ropes that I know, and I guide you through succeeding, getting into the field and doing it good. So please relax, and if you are considering switching profession, healthcare profession is the place. Of what use is joining or switching profession if you are not trained? My people perish due to lack of knowledge. So the Bible says. So guys, today we are here again to have another conversation. And I hope that this conversation will help you to be efficient. I want you to try and practice the things I teach. Tell me how it has helped you in your role. Remember, a healthcare professional is a doctor, a nurse, a midwife, a care worker, a senior carer, an occupational therapist, a radiographer, anything that has to do with health people. You are caring for them, you are taking care, you're giving them medication, you are their pharmacist, you are their occupational therapist, you are their psychiatrist, you are their psychologist. Wherever you fall in the place, we are all healthcare professionals. So this topic I want to deal with today is going to help every healthcare professional. Now, narrowing it down to, the care workers, the support workers. The truth is that if you are not trained, please go and get trained. There are so many courses you can do. There are different levels of qualifications. And I do also support and signpost people to organizations or to courses that you can do. I can give you that support, and I also train. So if you need that support, just send an email to ezobiakobridget@gmail.com. Now let's get into the meat of the day. So today I want to discuss a topic that's spread across different professions. The truth is that what we do and our role in people's life entails communication. So if you are not an effective communicator, it's going to be difficult for you to do your job and do it well. So today, and it's one of the courses in both the NVQ, starting from level 2, So even medical doctors, nurses, when they are in their program, they teach communication as well. So communication is very important. Remember, it is the bedrock of what we do. Somebody is unwell and they come, you've gone to attend to them. You need to communicate to know what's going on. And remember, communication is not only verbal. Communication can be non-verbal, because we also work with people that are non-verbal. So there are just some principles, okay? There are just some principles, and that is what I'm going to be teaching in this class. How to be an effective communicator for healthcare professionals. All right, so by means of definition, I want to define what communication is. Remember, in this channel, I always go with the layman's language because I want you to understand it. I teach you to understand. I I try to be that mesh between theory and practical because that is who I am. So communication is a way of transferring and receiving information. So communication is a way of transferring and receiving information with the aim of achieving a particular goal. Now, the most important thing is that when you communicate, what you have said or what you have communicated is received and understood, and there is a commensurate reaction that is either expected to show that there is understanding of what has been communicated. So remember, a communication is incomplete if there is no understanding. Okay? So I want to read something here. Paul Mayer states that communication is the key to success in every area. And if effective communication is basically what we need in our job. Effective communication is an exchange of information. It's an exchange of ideas, thoughts, and principles in ways that is clear, that is concise, that is we have an understanding, detailed, that is well received by the intended audience, and that is standard. So it is clear, it is concise, that is, it gives exactly what you want to communicate. It is understood. And how do you know that it's understood? There is a prerequisite, there's a response that you get that balances the information that was given. So when you're looking at the communication chain, there is the sender. There is the person that starts the communication, and then there is the receiver, that is the person that the communication is intended for, and then there is the channel, which is the mode or the channel of transfer of communication. So you can communicate via telephone, via writing, via speaking, oral communication, via acting, via showing signs, Mactoon. There are so many forms of communication. And then there is a response that shows that there's an understanding. So I wouldn't be speaking, can I have a cup of tea? And then your response is, oh, that dress is nice. There's a mismatch there. So when communication is effective, it is only complete after these 5 things. So there's a person that is sending, the speaker, the sender, the person that is sending the communication. There's the receiver, the person, the audience, the person that is expected to respond. Okay. Then there is the channel. That's number 3, right? Then there is the mode of communication. So there's the channel of communication. So are you using a telephone? Are you, and then that's the channel that conveys the communication. And then there is the mode of communication. And then there is a response. And your response will help us to know if the communication is effective. So in our role as healthcare professionals, why is communication important? Communication or effective communication is important because it improves understanding and clarity. That's number 1. So it improves understanding of a thing and clarity. Hello, John. How are you doing? Have you had something to eat today? Oh, no, I've not been hungry all day. Effective communication, what you said, your thoughts, your ideas, your feelings, they are clearly communicated. They are clearly transferred to the individual and or the group, and it is received, and there is a response that matches the, conversation. So the first one is it improves understanding and clarity. So everyone is kind of on the same page. Okay. Number 2 is that it increases productivity because you are going to support somebody and you guys are not communicating. There will be war. There will be war. If you don't have an understanding of each other, there will be war. So it's important that you are on the same. And that's one of the things I was trying to say when I was explaining, the 5. The language must be a common language. So I cannot be speaking English to you and you do not understand English. That information is as good as useless, right? Good. The third point is that it enhances teamwork. So it enhances teamwork between you and your service user, or you and your a colleague, or you and your company. However it is, it enhances team, because it promotes like good collaboration. It promotes like cooperation among the team. So both, let's assume I'm going to be using the carer, the senior carer, or the child carer, or whatever. Let's assume that it's a double up visit. Two people have gone to support. Maybe it's in a care home, or it's in a hospital, or is in a service user's home, or however the case is, and two people are supporting. If the two healthcare professionals are not in sync, there is no proper communication, it will distort the whole thing, and the person that is being supported will not be supported effectively. The truth is that communication is very important in whatever that we're doing. It also helps in better decision making. I'm going to give an instance, like when you're supporting somebody that has maybe some form of disability that affects their cognition, and the person is not able to communicate exactly how they feel or how they are feeling because of their state of health. It's always important to look for a way to communicate with them that will match, enhance, or make them understand what you're trying to say or what you're trying to do. I remember I went somewhere, and I saw a few people. They were supporting a gentleman, and the gentleman lives with autism spectrum, and he could not. His method of communication was slightly different from what every other person is used to. I really praise that support worker, because the person repeats what he says, and what he says, if he says going, he means coming. Now, because the support worker has read the care plan and understood, he knew how to communicate, and you know what? It was a smooth ride for him. So for me, I was really impressed. So it also helps to enhance teamwork, and it also makes you make better decision. Finally, it helps to build stronger relationship. People are more accepting of you. They are open to whatever you have to offer because of effective communication. So it helps you to build trust. So you're coming into somebody's house and you're speaking what they understand, and you guys are flowing. You hear things like, I've had that a lot. Most of the service users that I've supported, that really loved me, is because of effective communication. I remember one gentleman that I supported, bless him. He was not really open to care. He didn't want to just accept anybody, and we're not even from the same part of the world. And he had seen like maybe 4 or 5 people, and he had told the company that, sorry, I don't want these people. And they just said, let's try this person out. And the funniest thing, it was the most mundane thing that made us just click, and it's communication. So when you communicate, what you say, how you look, how you are speaking, the body language, they all matter. Remember, in communication, 80% of what is said is not verbal. Of what is communicated is not verbal. Even when you're communicating verbally, orally, speaking like this, So I would advise us to take this on board. Sorry, my lights shifted, and use it to your advantage. So now we're going to talk about the principles of communication. The principles of communication. I'm going for the purpose of this class, I'm going to be talking about 3 principles. There are over 7. I have about 7 that I've, but I don't know how much time I've got. But I'm going to talk about 3, at least, I'm sure. The rest I can just mention them. Number 1, as a healthcare professional, clarity. What did I say? Clarity. Whatever you are saying must be clear, concise. Now, it stands for the ability to communicate straightforwardly. Don't shadow box. Don't use indirect language. If you are supporting a service user, don't use indirect language. They may not understand. Not everybody is at the same, understands you or at the same cognitive level as you. If you are supporting somebody, that means that there is a lag somewhere, and that's why you have to speak clearly, clarity. Speak concisely. If you're speaking English, please speak English clearly. Okay. Now, let's say, let me give you an instance. I'm going to see John. I like to use John. I'm going to see John, and I want to ask John if he has eaten. And then I'm just saying, hey John, so how's your day been? Fine. So what has been up today? What have you been up to? Fine. I'm not getting what the information I need. But if I say, hello John, how you doing? I'm very well, blah blah blah. Have you eaten this morning? You see, what did you have for breakfast? And John can say, oh, I had, porridge, and I didn't really. Did you like your breakfast? I'm trying to now put perspective to it. What did you have for breakfast? Did you like your breakfast? Are you satisfied, or you are hungry right now? So even if you're asking questions, make sure that it is clear so that you can get the adequate response that you want. Number 2 is confidence. Now, a lot of people don't mention this, but as a healthcare professional, you communicate confidence. So when you are talking, one can tell if you are hesitating or not. Some people when they're talking, there is or there is now, they call it gapping. Like some people use it to gather their thoughts. If you're well prepared, you don't need to start doing that. So build your confidence, know what you're asking, know the information you want to pass, and pass it. Make sure that your information is true, is clear, you are sure of the source, so that you will not be, making all those, those things. It just makes you, all right, it makes you ineffective. It makes the communication, make the person that's even listening to you is not expecting anything special, Number 3 is concrete. Make your information, your communication, make it concrete, Ensure that whatever you are passing is concrete. That's, you are sure of what you know what you want. You know the information you want, so that you also understand the response that you are expecting, And another thing is language. That's number 4, language. Are you speaking the language that the person understands? Because if you are not speaking the language that the person understands, then you guys are not even communicating at all. So language is one of the principles of communication. It must be common language. So if somebody is non-verbal, but the person understands sign language, you must be able to communicate sign language for the person to respond to you adequately. Okay? So also ensure that it is correct. Correctness, as a healthcare professional, you must be sure. Don't just say hearsay. Make sure that the communication is correct, like what you are trying to communicate. Or if you are trying to get a response, or you are trying to find out something, be sure to say exactly what you are expecting. Be sure to communicate exactly, because when I keep saying say, it looks as if it's just verbal. Another thing I want to talk about is courtesy. How is it said? A lot of times some people just think that you can just say anything. Well, I'm just talking to him. After all, I'm just caring for the person. Do you know, if we're giving personal care, for instance, even if the person is in coma, we have to communicate. John, I will be washing your hands now. I will raise your hand up slightly. The person is not responding, but I am communicating. You must communicate courtesy. You must speak with some dignity and respect. So that way you also get a response that comes with dignity and respect. You give what you get. They are very important principles. Then I will talk finally about coherence. So put your words, put your thoughts together. You're asking a question, put your thoughts together. Don't just say, you are not straightforward with what you want to ask. I just wanted to know, let me give an instance. You are doing like a review on your service user, as the case may be, and you want to know if they are happy with the service provided, and if there's anything they want to change. Like, John, I just want to know, when your carers come, or when the nurses visit, do you laugh? Or do you laugh with them? Oh, okay. When last did you laugh? Oh, okay. Did they give you? You're not getting the point. The point is, how is this care? Do you think that we give you quality care? And then if the person says, I don't understand, you say, oh, okay, do they greet you when they come? Do they respect your privacy? Do they knock on the door? This is clear coincides. I'm trying to break down the question. It helps this other person to understand and know how to respond to me. So, you see, guys, I can talk and talk and talk and talk about communication. Communication is really a big deal for health and healthcare professionals, and we all need to have that armed. You cannot go and support somebody when you guys are not speaking the same language. If you are not, then you get an interpreter. But communication can only be effective and efficient when it is given with good intention, correctness, given in confidence, given concretely, given with courtesy, given speaking the same language that the person understands, through the channel that is accessible and understandable by the individual, and with a response that's commensurate to the question or the sender's intention. I hope that this class has been helpful for everyone. Anyways, if you still need more help in terms of communication, please let me know, and then I'm going to do it. I will definitely do a part B of this class because I'm not done with communication, because I want to tell us the downside if you do not communicate effectively. So thank you so much. Please do not forget to let your friends know, share it. Let's share the news to the world, share the channel, and let more people come and hear what we're doing. My name is Bridget Ezubiako, and it's an honor. It's a big honor to always come back again and again. Please, if you've not seen my other videos, it's not too late. Go back and watch it. Don't forget, subscribe, like, and share. And I will see you in the next one.